Hello, my name is Dr. Vinod Kumar. I am Consultant General and Laparoscopic Surgeon at Care Hospital, Mushirabad. One of the commonest procedures which we do as a general and laparoscopic surgeons is gallbladder surgeries. Now, how common is gallbladder surgeries in the general population? It is one of the commonest procedures being done worldwide, and it is one of the safest procedures that can be done. Now, indications for gallbladder surgery are gallbladder, any stones in the gallbladder or cancers that can be present in the gallbladder are dealt with gallbladder surgery, that is either laparoscopically or open procedure. Most of the questions what we see in patients is, I have a gallstone disease, do I really need a surgery? Male patients, whether they have symptoms or they don't have symptoms, if they have gallstones, they have to undergo surgery because they do not have the protection what a female patient will have from their hormones. Female patients, if they do not have any symptoms, because of their menstrual cycles, they are protected by their hormones, but men will not be protected by these hormones. And because of this, the gallbladder has a higher contractility chances and complication rates are higher in men when compared to the women. The other issue is gallbladder patients who, even without symptoms, those who will require surgery are diabetics, patients who have heart problems, or patients who have had prior history, that is, they had a history of jaundice or pancreatitis in the previous times. Now, what is the methods what we follow for gallbladder surgeries? Either we do a laparoscopy or open. The laparoscopy is the commonest procedure being done. In this, we put camera through the umbilicus, we dissect the and we assess whether the gallbladder can be removed laparoscopically or not, and if it is possible, we do it laparoscopically. In case there are complicated gallbladder, that is, there is an infection in the gallbladder because of which the intestines are stuck to it, in those situations it might not be possible to do laparoscopically. In that situations we do an open surgery. This is about the gallbladder surgery. How often do we present, how often is gallbladder surgery is done? It is the commonest, almost we do every month 10 to 15 gallbladder surgeries in our hospitals, and it is a similar way in most hospitals in all over the world. Gallbladder complications, what can be expected? That is another question what people ask. Usually less than 1% of the people will have gallbladder surgery complications, that is mild bloating sensation might be there. One of the commonest problems what we face is that laparoscopy might not be possible, so we have to convert to an open surgery, because it is not a failure of the surgery because of the patient's presentation. When gallbladder is infected, the intestines get stuck to it, and the chances of injury to the intestines or the bile ducts which carry the bile is higher in these patients. To avoid this, we usually do an open cholecystectomy. The other point what we would like to inform is, less than 1% of the people will have anatomical variations. That is, like every person is different in some aspect or the other. The anatomy inside the abdomen also, the liver, the bile ducts and the gallbladder will have some anatomical variations which can cause some amount of difficulties during the surgery and can lead to some bile duct injuries which later end up as bile leaks and might have septicemia. In those situations also, we can deal these by either endoscopic ERCP or through another surgery and deal the injuries at the moment when it is detected. In case of any further queries, you can always contact me.